Hello. In this video, I'll answer the 11 most frequently asked questions about birth control pills based on reliable medical sources. If you find this video helpful, don't forget to like it and subscribe to my channel for support. Let's get started. 1. How do birth control pills prevent pregnancy? They work in 3 ways. 1. They stop ovulation, the release of an egg. 2. Thicken the cervical mucus, making it harder for sperm to reach the egg. 3. They thin the lining of the uterus, preventing a fertilized egg from implanting. When taken correctly, they are up to 99% effective. 2. What types of birth control pills are there? There are 2 main types. Combined pills contain both estrogen and progestin. Progestin-only pills, mini pills, suitable for women who are breastfeeding or cannot take estrogen. 3. How should birth control pills be taken? Take 1 pill every day at the same time. If you're starting for the first time, it's best to begin on the first day of your period. If you forget a pill, take it as soon as you remember and continue your regular schedule the next day. 4. Do birth control pills work immediately? If you start for the first time, full protection usually begins after 7 days. During the first week, it's recommended to use an additional form of protection such as condoms. 5. Do birth control pills cause infertility? No, they do not cause infertility. After stopping the pills, fertility typically returns to normal within 1 to 2 months. For some women, ovulation may take a few extra months to resume, but this is temporary. 6. Do birth control pills cause weight gain? Scientific studies show that birth control pills do not cause long-term weight gain. Some women may experience mild fluid retention at first, but it's usually temporary. 7. What are the common side effects? The most common side effects include nausea, headache, breast tenderness, spotting between periods. These effects usually disappear within the first few months. 8. Who should not use birth control pills? Avoid using them without a doctor's advice if you are over 35 and smoke, have a history of blood clots or thrombosis, have serious liver disease, have a history of breast cancer. 9. Do birth control pills have other benefits? Yes, they do more than prevent pregnancy. They can also regulate menstrual cycles, reduce menstrual cramps, improve acne, lower the risk of ovarian cysts and endometriosis. 10. What should you pay attention to while using them? Take your pill at the same time every day. Some medications, like antibiotics or epilepsy drugs, can reduce effectiveness. Vomiting or diarrhea may decrease protection, so use extra protection if that happens. 11. Do birth control pills protect against sexually transmitted infections, STIs? No, they do not. Birth control pills only prevent pregnancy. To protect against STIs, condoms must be used. If you enjoyed this video, don't forget to like, comment, and subscribe for more health information.